When it comes to periodontal therapy, choosing the right treatment approach is crucial for long-term oral health. The decision is not one size fits all. Instead, it depends on a variety of factors unique to each patient and tooth. In this video, we'll walk through the main considerations and treatment options for managing furcation involvement. From traditional procedures aimed at maintaining health to advanced regenerative techniques, understanding these options helps ensure the best possible outcomes for both patients and clinicians. Let's begin by exploring the key factors that influence the choice of therapy. Several important factors must be considered before selecting a mode of therapy for periodontal issues. These include the degree of involvement, crown-root ratio, root length, and the degree of root separation. Additionally, the strategic value of the tooth, root anatomy, and any residual tooth mobility play significant roles. Endodontic therapy history, the ability to eliminate the defect, and the periodontal condition of adjacent teeth are also crucial. By carefully evaluating these aspects, dental professionals can tailor the treatment plan to the specific needs of each case, maximizing the chances of success. Traditional periodontal treatment procedures focus on maintaining oral health and preventing further disease progression. These methods do not attempt to regenerate lost periodontium, but instead aim to create an environment conducive to effective plaque control. The main goal is to stabilize the condition and prevent worsening. By maintaining the health of the supporting structures, these treatments help preserve the function and longevity of the affected teeth. Let's look at how traditional procedures are tailored to different grades of furcation involvement. For Grade 1 furcation involvement, the focus is on initial preparation and cleaning. This includes scaling and root planing to remove plaque and calculus, as well as curettage or gingivectomy to expose the furcation area for better access. Odontoplasty, which reshapes the facial groove, is also performed to prevent future plaque accumulation. These steps are essential in maintaining the health of the periodontium and preventing the progression of the disease. Early intervention at this stage can make a significant difference in long-term outcomes. In cases of shallow Grade 2 furcation invasions, more advanced procedures may be necessary. Osteoplasty, sometimes combined with limited ostectomy, helps reshape the bone for better access and cleaning. Odontoplasty can also be performed to further reduce plaque retention areas. These interventions are designed to halt disease progression and maintain the tooth's function. By addressing the anatomical challenges early, clinicians can often prevent the need for more invasive treatments later on. For severe, Grade 2 to Grade 4 furcation involvement, surgical elimination of the furcation may be required. Root resection or amputation involves surgically removing the affected root, commonly performed in maxillary first molars. Hemisection, which removes the root along with the crown, is typically done in mandibular molars. Bicuspidization splits a two-rooted tooth into two separate portions, often used in mandibular molars. Tunnel preparation was once used to improve access, but is no longer recommended due to a higher risk of root caries. These surgical options are reserved for cases where less invasive treatments are insufficient. When dealing with Grade 3 and Grade 4 furcation involvement, root resection and root separation are the mainstays of treatment. These procedures aim to remove the diseased root portions while preserving as much healthy tooth structure as possible. By carefully separating or removing roots, clinicians can improve access for cleaning and reduce the risk of further periodontal breakdown. However, these treatments require careful case selection and precise surgical technique to ensure long-term success. For Grade 2 furcation involvement, regenerative and reconstructive procedures offer hope for restoring lost periodontal structures. Techniques include autogenous bone grafting, such as osseous coagulum or bone blend, and the use of allografts, like freeze-dried bone. Alloplasts, including hydroxyapatite and tricalcium phosphate, can also be used. Citric acid root conditioning with a coronally positioned flap and guided tissue regeneration are advanced methods that aim to regenerate bone and periodontal ligament. These techniques are selected based on the specific clinical scenario and the potential for regeneration. While regenerative techniques can be effective for Grade 2 furcation involvement, their success in Grade 3 and Grade 4 cases is limited. The complexity of the defect and the extent of tissue loss make regeneration challenging. In these situations, traditional surgical approaches like root resection or separation remain the primary options. It's important for both clinicians and patients to have realistic expectations regarding outcomes and to focus on maintaining oral hygiene and regular follow-up care to preserve the remaining tooth structure.